Get started. I know people are still coming back from lunch, but to try to stay on time, we'll hear from our second panel of speakers and then hold our questions until the end of this session. We'll hear in this session from first Robert Bullard, the Dean of the School of Public Affairs at Texas Southwestern. Robert, thank you for being here. And then we'll hear from Marianne Egelman, Lato, Senior Staff Attorney at the Earth Justice Organization. So, Robert, welcome.
Good afternoon. My presentation deals with health as a major driver of environmental justice. My job is to connect the dots, and I'm going to do this in 30 minutes, 30 years of connecting dots in 30 minutes. So, for those of you who may not know, I like writing. I'm a researcher by training. I've written 18 books dealing with housing, transportation, sustainability, environment, health, disaster response, food security, etc. And the central theme of all of those books is health, equity, and justice. If it's dealing with housing, it could be housing equity or housing justice. If it's dealing with health, health. So I'm really pleased that we're talking about health and equity. And I think for the environmental justice movement, it was founded based on redefining what environmentalism is as it was practiced in the United States. Health was always at the center of the environmental justice movement. We redefine environment as everything, where we live, work, play, learn, worship, as well as the physical and natural world. The environmental justice principle, environmental justice embraces the principle that all people and communities are entitled to equal protection of environmental laws, health laws, employment, education, housing, transportation, and civil rights laws. In other words, it's a very holistic conceptualization of what environment is. In the real world, we know that all communities are not created equal. There are some that are more equal than others. And if a community happens to be poor or physically located on the wrong side of the track, or a community happens to be people of color, it receives less protection. It receives less than those things that make communities healthy. And historically, there's a direct correlation between exploitation of land and exploitation of people. And so if you look at how do we make communities whole, how do we talk about defining healthy communities, you have to put equity and justice, and the question of racial justice has to be also not a footnote, but has to be at the center when we talk about environmental justice and health equity. We have been struggling for at least a decade trying to get our federal government and our very bright people to look at environmental justice. You know, we were doing it for many years, but we wanted some bright people to do it. And so in 1999, the Institute of Medicine actually did a study, a report in and they found what we had found. You know, we were amazed. It showed that people of color and low-income communities are exposed to higher levels of pollution than the rest of the nation. These groups also contract certain diseases more often than affluent white communities. Now, that's what IOM found. And communities knew that decades earlier, but we needed smart people to say that. There are some communities that are physically located in the wrong place, and there are some communities that have the wrong complexion for protection. That's the title of my latest book. Race maps closely with inequality, and the geography of place and vulnerability are very highly correlated. And so if we talk about apartheid-type housing, residential segregation, we talk about lack of access to transit, and you talk about transportation planning historically that divided communities, that disrupted communities, that actually killed communities, highways, freeways, roads running through neighborhoods and dividing communities, following a path of least resistance. Historically, I wrote a book called Transportation Racism that dealt with that, and health was a major part of that. More than 100 studies now link racism to worse health. More than 200 studies plus show environmental studies that show race and class disparities. Place matters, race matters. Zip code is still the most potent variable for predicting health and well-being. The poorest communities in this country also have the poorest environmental quality and health outcomes. And so when we talk about zip codes and we talk about place, all zip codes are not created equal. This is a map of all the zip codes in the United States. The best zip codes are the darker area. The lighter the zip code, the worse the area. You'll see a pattern shaping up in terms of where the light areas are and the worst. The dark red area represents, and this is the worst zip codes, the most stressed zip codes, economically stressed, communities that have the most, where the health disparities are rampant, where all kinds of, where inequality is basically the bumper sticker. The dark red areas, and somebody told me, that's not red, Dr. Bullard, that's salmon. Well, I said, well, in my coloring pad, they didn't have salmon. I said, I have a PhD in sociology, not Crayola. Here's a map of the U.S. You divide the U.S. in North, South, Midwest, and West, 4 regions. We have 4 regions. So we have 10 regions EPA. Region 4 and Region 6 are the southern region. You'll see that there are some major disparities that jump out at you in terms of where these belts are. The black belt, the poverty belt, the uninsured belt, the stroke belt. You start seeing those areas. And all regions are not created equal. This is the poverty belt. Look at that heavy blue area along the southern tier states. You'll find that line, that picture, that map, you map vulnerability, you map health disparities, you map environmental problems, you map lack of insurance. You see this map. This is the old 50 map that segregation was legal. And the red area represents segregated required by law. And you start looking at this map. This is a heavy green area. It represents where mostly African Americans are located in 2010. That maps very closely with the old 50 segregated map or the black belt map. And this is a map of where mostly Latinos are located. South Florida, Southwest, West. This is a map of the United States. That heavy blue or purple area represents where people of color are located in the United States in 2010, and you can see that pattern. Just keep these maps in mind. This is a map of absolute upward mobility across USA. The dark red area represents the areas where upward mobility is most difficult for moving out of poverty, moving up the economic ladder. You'll see this pattern. This is this salmon area, the pink area represents the congressional districts where people are food insecure. Food hardships, don't have enough money for food. The heavy red areas, brown areas represent where food deserts. People don't have cars and there are no grocery stores. So what do the people do? They eat very poorly. This is a map of, I call this the obesity map. Some people say, oh, that's the fat map. Look at the most obese state in the country is Mississippi. And the skinniest is in Colorado. People say, well, how can you get Colorado so skinny? You say, well, it must be mountain high air, bean sprouts, tofu, and marijuana. So this is a map of state health departments that's the worst. The dark blue, you see the pattern that's shaping up? The worst place to be a kid. Look at that yellow down at that southern tier. This is the healthiest states. It's brown. Look at the conspicuous absence of any brown in the South. The worst states, the unhealthiest states, Mississippi, Alabama, Arkansas, you start naming, 7 out of 10 of the worst are the unhealthiest states. This is not my data. So the regions, U.S. regions are not created equal. Southeast United States, it has the stroke belt, obesity belt, hypertension belt, diabetes belt, and kidney belt. So when you talk about these maps and how they interact, interactivity belt, look at that dark area for inactivity. Diabetes, obesity, heart disease, heavy dark red. Stroke, cancer, dark brown. Uninsured belt, look at that. I had another map, I took it out because I didn't want to be political, that showed red state, blue state, states that don't want Obamacare, Same thing. I took that out because I didn't want to be political. Here's the black college belt. Most of the black colleges in the United States are located in the southern United States. We don't know why, but that's where they're located. 83% of the 104 HBCUs are located in the South. So we decided to say, well, since our schools are located in the South, we need to create a HBCU equity consortium to deal with those issues on those maps. Since our schools are located in the heart of all of these belts, we needed to. So we did that. Dr. Beverly Wright and myself, Dr. Wright said, Dillard, I'm at Texas Southern. We said, we're not going to wait for anybody else to do it. We're going to do it whether or not we get funding or not, and we have some funds for it. But our students, our faculty, and most of our emphasis is on dealing with these issues in terms of building new leaders and addressing those disproportionate problems in that region. And so we use a health and equity lens. We use a racial justice lens. We don't make it a footnote. We don't say we're going to think about it. That's at the core, at the heart, where we deal with environment, put justice behind it. Transportation, energy, toxics, waste, transportation, climate. I got transportation up there twice. Parks and green space, food and water security, sustainability, disasters, and resilience. I wrote a book 25 years ago, Dumping in Dixie. I wrote that book. It was 160 pages. It was the only book on environmental justice. Westview Press made it a textbook. And when I got my first royalty check, I almost fainted. I said, oh, they must have made a mistake. They got too many zeros on here. But it was the only book. Today, that was 1990. Today, there are hundreds of books dealing with environmental justice. What we found is that Dixie is different. Do I need to repeat myself? There's something about the South. The South's the only place that had slavery that was codified. Jim Crow that was codified. And looking at the resistance to civil rights, environmental protection, and you start looking at this stuff, and you start saying, waiting for the government. I'm going to give you one case study, waiting for the government beyond the Flint water crisis, poison wells in Dickson. All the attention is on Flint right now with the water. But that was a case that I worked on for 9 years in Dickson, Tennessee, which is like 40 miles west of Nashville. This is a case where a county-owned landfill poisoned the wells of these families that had owned this land for 7 generations. The government tested the wells, city, county, EPA tested the water and said there's nothing wrong with your water, even though we have found TCE. It's okay to drink, okay to bathe, and okay to wash your clothes in, etc., your shower. They found TCE in these white people's wells and springs. They gave them bottled water within 48 hours and gave them a plan. Now, I'm not making this up. We have 1,200 pages of documentation. They tested their wells for 11 years, and they found TCE several times, but would not notify the families, the black families, about what was going on. They started testing dogs. This is the landfill, which is like 54 feet from this family's homestead. They warned white families, put these signs up, none of this for black families. They tested ducks and dogs that were at the Dickson County Humane Society, dogs that were on death row, waiting to be euthanized. They tested their wells, but would not test this family's well that was 54 feet. The U.S. Geological Survey tested wells within a 2-mile radius of this landfill. 2-mile radius, all the wells, but they did not test this family's well that was 54 feet. And the first time they found TCE was in 1988. This family drank poisoned water from 1988 up until 2001. The lawsuit was filed. I got called. The NAACP Legal Defense Fund, NRDC with a lawyer. I was one of the technical experts on this particular case. Our students, our center, we worked with this family, gathered the data. It made the New York Times, Washington Post, People Magazine, Essence, whatever. But the fact is, The county spent $5 million fighting this family over 9 years, and the lawsuit was settled, but they spent $5 million. There were 3 other lawsuits that were filed by white families. They settled them within a year. But they fought this black family for 9 years. They charged the black families water that they contaminated. You understand what I'm saying? So this I call the poster child for toxic racism. This is before Flint. So the point I'm making is that living with pollution and the way that government responds responds very differently. So even when you have the facts, that's not enough. How racism penetrates our policy making and our decision making. Blacks are 79% more likely than whites to live where industrial pollution poses the greatest risk. This is in 19 states. That's true. For whites, for Hispanics, that's 12 states, and for Asian, it's 7 states. If you look at a recent study that was done by the University of Minnesota, found that people of color breathe 38% more pollution than whites, 38%. And for nitrogen oxide, it's 46%. Now I could live with that if it's 46% more good stuff, but this is bad stuff. Geography of air pollution is not randomly distributed. Non-attainment areas, you can look at the greatest percentage of Americans who live in non-attainment areas. It's by race and income. People of color more likely live in the dirtiest cities. This is not just a class thing. It's not just poverty. You can't reduce it to poverty. Affluent African Americans who make $50,000 to $60,000 are more likely to live in neighborhoods that are more polluted than whites who make $10,000. This is a study done by 2 sociologists at the University of Colorado. Toxic waste and race, we did a study, and we found that all of the toxic waste facilities in the country is not randomly distributed. 56% of the residents who live within a 2-mile radius of all the toxic waste facilities in this country are people of color. If you add 2 or more facilities, that number jumps to 69%. So if you look at 69% of all the residents who live within a 2-mile radius of these toxic waste facilities are people of color. People of color only make up about 38% of the population. We are overrepresented in those places that pose the greatest risk in terms of health. This is a map of all the refineries in the country. And living near a refinery or on the fence line, fighting for clean air in the shadow of oil refineries. And we're talking about real, this is not trick photography. These are real, this is in Houston, Texas, along the Houston Ship Channel. If you look at parks and pollutions, don't mix. You don't need to have a park. All you planners talk about zoning. Parks and pollution don't mix. Children pay the price of pollution with their health. Great parks. This is Central Park. This is LA, that's Griffith Park. No, I was waiting for LA. That's Grant Park in Chicago. And that's Piedmont, no, that's in Houston, Herman Park in Houston, and that's Piedmont Park in Atlanta. Going green. Parks are healthy. We want people to go outside. We know the impact of walking. Walking creates a lot of healthy activities, and walking in nature stimulates mental, and you think, I do some of my best writing in my head and talking into the microphone, walking. A walk in the park soothes the mind and body. You can live longer. There's one that shows you live longer, 7 years on average. 30 minutes, walk every day, can extend your lifespan by 7 years. 60-something, I want my 7 damn years. All parks don't look like this. Great parks, nice place. Get these pictures, nice. You know, kids are playing. Some of our parks, these are real pictures I took. Norco, Louisiana, park sandwiched between 2 refineries. Stand there 15 minutes. Another park in another parish. That's Corpus Christi, Texas. This is Houston, Texas. Kids playing across from refineries. If you talk, this is Port Arthur, Texas. Public housing project located just across from, get the name of the park. So when we talk about, this is Baytown, Texas. Public housing located across from a refinery, one of the largest refineries in the country. We won't call any name, but the initials you can see. So people say, who's in danger? Look at race, poverty, and chemical disasters. Who's in that kill zone? Well, people of color and poor people are more likely to be in that kill zone if there is a disaster. We're talking about North Richmond in California, or you talk about Louisiana, or you talk about Texas, or you talk about Southwest Detroit. And so when we talk about so close, that does not make any sense. So when you talk about so close, that does not make any sense. So when we talk about so close, that does not make any sense. That's 4 different cities: Port Arthur, Corpus Christi, Houston, Baytown, Richmond. Fires, explosions, evacuations, breathing that stuff, you get sick. And so we talk about the most vulnerable population in those kill zones is children. 1/3 of all U.S. school children are at risk of a chemical catastrophe. This is a school, this is Houston, located across from a big refinery. This is Cesar Chavez High School. Cesar Chavez High School. So you know who goes to that school. So when we talk about schools, in Houston, there are 133 schools and 7 hospitals that are within 1 mile radius of high-risk chemical plants, threatening 101,000 students and an unknown number of patients. We're talking about some serious stuff. Many of our schools are located close to these facilities. It took the USA Today to come up with a map that showed where these schools are. The bigger the dot, the worse it is. And so when we talk about toxics in school, studies are coming out now that's showing there's a relationship between pollution near these schools, student achievement, and health. And so when we talk about dirty power plants and coal plants and children, 68% of African Americans live within a 30-mile radius of a dirty coal plant. That's true for 56% of whites and 39% of Latinos. And so when we talk about the impact, who pays the price? It's children. We pay the price in terms of health effects. Asthma. Asthma is the #1 reason why kids are out of school. And if you talk about African American Latino children, are 3 to 4 times more likely to be hospitalized or die from asthma. This is not sexy talk. This is stuff that's real and it's powerful. When we talk about transportation. Transportation has a major component when it comes to air pollution. I was in Atlanta in '96 when we could not drive our cars. We had to take MARTA. For many Atlantans, MARTA M-A-R-T-A stood for Moving Africans Rapidly Through Atlanta. They didn't want any part of MARTA. MARTA's supposed to be in 5 counties, and the whites in the suburban counties said, we don't want MARTA. It's going to bring crime, drugs, and black people. So MARTA's only 2 counties. This is 1996 Olympic. We couldn't drive our cars, so we had to park. The air was clean in July. Those 2 weeks that they had the Olympics, and it said the reduction in motor vehicle emissions went down. It went down. It says the U.S. Center for Disease Control and Prevention that when Atlanta Olympic Games in '96 brought about a reduction in auto use by 22.5%, almost 23%, and emergency room visits by almost 42%. So we know that when you get cars off the road, when the air is cleaner, when you have alternatives to driving, there are health benefits from it. And then you can calculate those benefits in terms of dollars saved, in terms of lives saved, and in terms of kids not out of school, and parents not being away from school because of a kid being absent. When we talk about justice question, last slide, we say sustainability and livability cannot be achieved if we do not address these equity issues. We can never talk about sustainable, livable, healthy without addressing the equity components. We can build the greenest cities and the best cities in the world here in this country, but if we don't address those legacy issues, if we just green those cities and there's no brown and black and green, I bet we're not creating something that's sustainable. Addressing equitable development, families below poverty, widening health, income, and wealth gap, addressing equity is a prerequisite to achieving healthy, livable, sustainable, and resilient communities. That's what our HBCU Equity Consortium is all about, building those and then linking up with many of our major majority institutions we call them PWIs, predominantly white institutions, to work with us. Now, that ain't my term, they call them PWIs, to work with us, and we have lots of collaborations with other institutions to work on this, but we have to have our HBCU Equity Consortium being the driver because we're there 24/7. Our partners, our other partners are only there when we can pay to bring them down or whatever, meet up at meetings. But the idea is to train the next generation of leaders, scientists, planners, organizers, educators, architects, to work on these issues and use the frame that we have: equity, justice, and addressing health at the center of all of it. Healthy, livable communities. And so we are working hard. And as I said, we're not going to, let a little thing like funding stop us. We're going to do this, and we're going to have an impact that will have a footprint that will be 2-3 generations away. Thank you very much.